So it seems like you've had a very extensive work in the field, but throughout your experiences, can you share some of the pivotal moments or key influences in your decision to specialize in health equity, for example, leadership and development, and doing so if you can help share how the field has evolved.
So, the first leadership development program I had the opportunity to participate was put on by the UK's National Health Service. Must have been probably 20 years ago or more. And I remember that was my first experience of having a 360-degree appraisal. And it wasn't a very positive experience in that the feedback I got was effectively to be less me. I was got some recommendation about you are aggressive, you are too outspoken, the usual things as angry black woman type of tropes. And the interesting thing for me there was that like I said, it was my first experience of that sort of training, and I thought there must be something. Let me try and be less me. Let me be different. Let me be this model of leadership that I was told is the thing to be. And within a few weeks of trying that, a group of
Group of
my
my
colleagues
colleagues
actually
actually
sent a
sent a
delegation
delegation
to
to
come and
come
check
and
if I
check if
was
I
all
was all
right
right
because
because
I
I
wasn't
wasn't
being
being
myself.
myself.
And
And
so,
so,
so
so
then
then
speaking to
speaking to
my
my
boss at
boss
the
at the
time,
time,
I
I
said, "Look,
said,
this
"Look,
was
this was
why,"
why,"
and
and
everything. And
everything. And
she took
she
a
took
look
a
at
look
this
at
and
this
said,
and
"This
said,
is
"This is
absolute
absolute
rubbish.
rubbish.
There is
There is
nothing
nothing
wrong
wrong
with
with
being
being
you,
you,
and
and
how you
how
are
you are
not
not
just
just
aggressive.
aggressive.
You're
You're
very clear and assertive." She gave me some constructive feedback. That countered the one I'd been given by professional appraisal people who didn't actually understand or hadn't even tried to understand the cultural context that I was operating within. So I remember reflecting on that and thinking that if I was had this sort of negative experience. Now, this is, leadership program has been rolled out on across the country at the time, and as I learned, it was a global movement at the time. What's other people's experiences? I actually went to a point of ask and started to ask, well, have you done this? Are you doing this leadership program? Who are the leadership models that you get told to emulate? What are you being told to do? And I found out that, first of all, there was a lack of models that looked like us. And I make no apologies by specifically focusing on Black women at the time. There were we were seen as not appropriate for leadership, and we had to change in order to be. You had leadership potential, but you had to change. And I thought, this is odd and this is strange. Before that, I confess to say I actually didn't know that mentorship was a thing. I had, in my public health training, had intentionally sought out women who were doing the job I wanted to do and approached them and said, can you support me and help me become
Become
what you
what you
do?
do.
I didn't
I
know
didn't
that
know
was
that was
mentorship.
mentorship.
And
And
I'm
I'm
very
very
proud
proud
of
of
to
to
have
have
been
been
mentored
mentored
by
by
two
two
dynamic
dynamic
women,
women,
not
not
black,
black,
because at
because
that
at that
time
time
I
I
don't
don't
recall that
recall
there were
that there were
many
many
black
black
women in
women in
consultants
consultants
in
in
public
public
health in the
health in the
space that I
space
was
that I was
working in
working in
community
community
disease
disease
control at
control
the
at the
time.
time.
But
But
these were women who everybody had accused of the same thing I was being accused of: being too loud, being too confident, being too assertive. Um, and they mentored me to be comfortable to be myself, and that was a legitimate part of the public leadership ecosystem. But on the back of that, I started saying, if I didn't see people like me, and the next generation are not seeing people like me, so we started sort of informally started trying to sort of build networks and offer support to people who were on the same journey, and to pull other people together and say, you really should actually share what you do so that others can learn from it. And that's kind of how I got into the sort of leadership development part of my role, and and recognizing, again, linking that back to equity, because if you change the makeup of the people in the room when the issues are being addressed, are discussed, and solutions are being put forward, you change the nature of the solutions that are being brought forward, and you actually increase the likelihood that you'll get the right solutions for the challenges that we're facing. And I found this most significant in, back again, TB. I was then leading regional TB program, and I had the annual
Annual
conference,
conference
the
was the
first
first
time that
time
I
that I
invited a
invited a
TB
TB
patient
patient
to
to
talk
talk
to
to
a
a
room
room
full
full
of
of
almost
almost
exclusively
exclusively
men
men
who were
who were
respiratory
respiratory
physicians who
physicians who
specialized
specialized
TB. She
TB.
was a
She was a
young
young
woman
woman
in her
in her
20s
20s.
at the time, who'd suffered from extrapulmonary tuberculosis. And her, for years after that, I had clinicians who attended our conference say to me, that was the first time I'd heard it from the patient's perspective. These are people who work with TB for years. Um, and again, that came back to the fact that if we are trying to solve the problems without with one hand tied behind our backs and without the knowledge and the experience of the people who we say we're working for. And so in everything I do, and I've done since then, I'm always looking around the room and saying, who isn't here? Who isn't speaking? Who are we solving this problem for? And also reminding myself that just
Just
because
because
I'm in
I'm
the
in the
room
room
doesn't mean
doesn't
that
mean
I'm
that I'm
representing the
representing the
entire
entire
ecosystem or
ecosystem
the
or the
underrepresented
underrepresented
group.
group.
I
I
should
should
also
also
ask
ask
myself
myself
that
that
question.
question.
Who's
Who's
not
not
here?
here?
Whose
Whose
voice
voice
isn't
isn't
heard?
heard?
Whose
Whose
perspective are
perspective
we
are we
missing?
missing?
And I
I
think
think
that's
that's
what
what
drives
drives
me
me
is
is
every now
every
and
now and
then
then
I've
I've
written,
written,
you
you
write a
write
bit
a
of
bit
thing
of
and
thing and
say,
say,
who's not
who's not
here?
here?
Whose
Whose
perspective
perspective
haven't I
haven't I
considered?
considered?
And then
And
go
then
and
go
rewrite
rewrite
it.
it.
Or
Or
get
get
someone else
someone
to say,
else
can
say,
you
can
look
you
at
look
this
at
to
this
say
to
what
say
I have
what I have
not
not
considered? And I think that humility in recognizing that no matter how much experience you have, you cannot be confident that you can speak for everybody or the various perspectives that should be considered, helps you to build better systems and to build better solutions and to be intentional about inclusion and representation.